Assalamu alaikum, dear students. I am Dr. Mohammad Salman. Today, I will discuss about the blood group system. Before starting the blood group system, we have to know what is blood group system and what is the blood types. There is a slight difference between blood group system and the blood types. So, what is blood group system? A group of related red cell antigens that show similar chemical, genetic, and reactivity properties constitutes a blood group system. Example like OAB blood group system and RH blood group system. Now we have to know what is blood types. Within a blood group, example like ABO system, in ABO system there may be two or more different blood types like A blood type or B or O or AB blood type. However, the terms blood group and blood types are often used synonymously. For better understanding, we have to know some terms and their meanings. Those terms are agglutinogen and agglutinase. First of all, we have to know what is agglutinogen. It is nothing other than the antigens. So what are the antigens? The membrane of human red cell contain a variety of blood group antigens, which are also called as agglutinogen. Remember, we have learned earlier in general physiology, all the cells of our body are covered by a cell membrane. And the composition of cell membrane includes carbohydrate, protein, and fat. And these carbohydrates constitute the agglutinogen. So, agglutinogen must be present on the red blood cell membrane. Remember this very carefully, as because the external viva examiner will ask you this question: where it is located, the agglutinogen? Your answer will be all the agglutinogen or antigens will be located on the membrane of red cell. Now, come to the agglutinins. The synonyms of agglutinins are antibodies, and antibodies are none other than the plasma proteins. And we have learned what are the major plasma proteins present in our plasma. Those are albumin, globulin, fibrinogen, and prothrombin. Among these four plasma proteins, globulin very specifically, globulins are considered as the antibodies who are also called as agglutinins. And obviously, these agglutinins are one type of plasma protein and they will be present in the plasma. So, if anyone asks you, where are they located, the agglutinogen and agglutinin? Your answer will be agglutinogen will be located on the surface of red blood cell and agglutinins will be located in the plasma. Now, we have to know what is the basis of blood group system. Remember, this is a very important topic. So, come to the main point. What is the basis? It is the presence or absence of group-specific agglutinogen or antigen on the red cell membrane. So, if the agglutinogen or antigen A present on the red cell membrane, we will call it blood group A. If the agglutinogen B present on the red cell membrane, we will call it blood group B. And if the both agglutinogen or antigen A and B present on the red cell membrane, we will call it AB blood group. And if none of them, A antigen and B antigen, is present on the red cell membrane, that means if the A antigen and B antigens are absent on the red cell membrane, we will call it blood group O. Here O stands for 0. In American English, they call the 0 as O. So O is not a letter here, it means 0. So if there is no antigen present on the red cell membrane, we will call it the blood group O. Now, we have to know what are the major blood group systems and other minor blood group systems. Major blood group systems are clinically important, and those blood groups include ABO blood group system, RH blood group system, and MN blood group system. And other minor blood groups includes Lutheran blood group system, Kale, Colton, Duffy, Kidd, Diego, Lewis. etc., etc. You don't have to remember all those names of minor blood group system. Just remember three major blood group system. There is ABO, RH blood group system, and RMN blood group system. If anyone asks you what is the clinical importance of MN blood group system, just remember the MN blood group system used to detect the paternity, and it is heavily used in the forensic medicine department. Now, among these three major blood group system, that means ABO, RH, and MN blood group system, which blood group system is considered as the classical blood group system? The answer is simple. That is ABO blood group system is considered as the classical blood group system. Now, the teacher will ask you why we consider the ABO blood group system as the classical blood group system. There are specially two reasons behind this calling ABO blood group system as the classical blood group system. And those reasons are: reason number one, if the ABO blood group systems are not matched, the mismatched blood transfusion reaction will be acute and severe. This is the first reason. So, what is the first reason? First reason is the mismatched blood transfusion reaction for the ABO blood grouping system will be acute and severe. And the second reason is it obeys the both part of Landsteiner's law. Now you may ask, what is the Landsteiner's law? We will discuss about the Landsteiner's law bit later. So have some patience. Now focus on the reason of calling the ABO blood group system is as classical blood group system. Why we call the ABO blood group system as a classical blood group system? There are two reasons of calling this blood group system as classical. Number one reason is the mismatch reaction is more acute and severe, and the number two reason of being called classical is it obeys the both part of Landsteiner's law. Now, what is the physiological basis of ABO blood group system? As I have said earlier, the presence or absence of group-specific antigen or agglutinogen on the red cell membrane is the actual basis of ABO blood group system. Now, we will discuss about the agglutination. What is agglutination? Agglutination is clumping of red blood cell due to antigen reaction with corresponding agglutinin. A single ABO antibody has 10 binding sites and can thus cross-link 10 red cells, while the RH antibody has only 2 binding sites and can link 2 red cells. So, features of agglutination are: if agglutination occurs, it usually visible to naked eyes. You can see it without the help of microscope, but to use microscope if you want to confirm the agglutination. So under the microscope, the clumps are visible as dark masses and the outline of the RBCs cannot be seen. Now, we will discuss about the Landsteiner's law. Landsteiner's law has two definite parts. The first part or the first law states that if an agglutinogen is present on the red cell membrane, the corresponding agglutinin must be absent from the plasma. And the second law states that if an agglutinogen is absent on the red cell membrane, the corresponding agglutinin must be present. So what does it mean? The first law states if an agglutinogen, that means if an antigen is present on the red cell membrane. Suppose your red blood cell contains group-specific antigen A on its red cell membrane. So, the corresponding agglutinin for the antigen A will be alpha antibody or alpha agglutinin. So, according to the first law, if there is presence of antigen A, there will be absence of alpha antibody. That means there will be no alpha antibody in that individual's plasma. And the second law states, if an agglutinogen is absent on the red cell membrane, the corresponding agglutinin must be present in plasma. So what does it mean actually? So if your red cell membrane contains A antigen on its membrane, and the alpha antibody it is its corresponding agglutinin. So according to the second law, if an agglutinogen is absent on the red cell membrane, that means B antigen is not present. Obviously, B antigen is not present on your red cell membrane. So the corresponding agglutinin for B antigen is beta antibody. So beta antibody will now must be present in plasma. So after completing the whole Landsteiner's law, we have ended in this result. If you have A type of blood group, that means if you have A antigen on your red cell membrane, alpha antibody will be absent in your plasma according to the first law of Landsteiner's. And according to the second law, there will be presence of beta antibody in your plasma. Now, come to the RH system. Aside from the antigen of the ABO system, those of the RH system are of the largest clinical importance. That is the second major blood group system we have discussed earlier among the three blood group system. Antigens or agglutinogens of RH system. So, what are the antigens present in the RH system? There are 6 common types of RH antigen, each of which is called RH factors. So, what are those 6 RH factors? These 6 RH factors are designated as capital C, D, E, and small c, D, E. A person who has a C antigen does not have small c antigen, but the person missing the capital C antigen always has the C antigen. Now you have to remember this. Among all these 6 RH factors, only capital D factor is considered as the RH antigen. So, all these 4 factors are RH factors. But among these 6, only one is considered as RH antigen. And which one it is? It is the capital D. Capital D will be considered as the RH antigen. If the capital D antigen is present on your red cell membrane, we will call it the positive RH blood. And if the capital D antigen is absent on your red cell membrane, we will call it RH negative blood. Now, if we want to compare between ABO blood group system and the RH blood group system, there are some difference we can see. And what are those differences? At first, ABO blood group system will obey the both part of Landsteiner's law. But in case of RH blood group system, it does not obey the second part of Landsteiner's law. So once again, what was the second part of Landsteiner's law? It was if an agglutinogen is absent on your red cell membrane, the corresponding agglutinin must be present in plasma. So what does it mean actually? So suppose on your red cell membrane, there is no RH antigen present. That means capital D is absent on your red cell membrane. According to the second part of Landsteiner's law, you were supposed to have RH antibody, that is anti-D antibody in your plasma. But it is not true. We do not have anti-D antibody if the antigen D absent on red cell membrane. That is the basic difference between ABO blood group system and the RH blood group system. And the second difference is mismatched blood transfusion reaction in case of ABO blood group system is more acute and severe. But in case of RH blood group system, the mismatched reaction will be more delayed and less severe. Now, what are the clinical significances of agglutinin of RH system? Anti-D agglutinin can be formed by exposure of a D negative individual to D positive red cell by transfusion of blood or by entrance of fetal D positive blood into the maternal circulation. Now, we have to know why it is very much important to know everything about the blood grouping. What is the importance? What is the clinical correlation? So, in clinical practice, we have to do some blood transfusion in many cases, and that's why we have to know about blood transfusion. Intravenous administration of blood to help replenish excess blood loss due to hemorrhage or otherwise is known as blood transfusion. So, before doing blood transfusion, what are the tests should be done? Number one, we have to do blood grouping or blood typing, whatever you want to call it. And number two, it is cross-matching. And number three, screening for possible infectious agents like HIV, syphilis, hepatitis B and C. Now you have to know what are the indications of blood transfusion. What do you mean by indication? Indications are those situations or demanding situations in which you are needed to give blood transfusion to an individual. So, what are the indications? What are the cases in which you will do some blood transfusion? You will give an individual a blood transfusion. So, number one case, it is anemia. If a patient suffers from severe anemia, you need to transfuse him or her blood. Number two, major surgical operation. During surgical operation, there must be severe, moderate blood loss. And in those cases, you have to transfuse blood. Number three, accidents resulting in considerable blood loss, like road traffic accident. In those accidents, an individual may lose considerable amount of blood. Number four, cancer patients requiring therapy. Number five, women in childbirth and newborn babies in certain cases. It is more or less common in women during childbirth, there will be moderate or severe blood loss. Number six, patients of hereditary disorders like hemophilia and thalassemia. And number seven, severe burn victims. So, what is cross-matching? Cross-matching. In cross-matching, donor red cells are mixed with recipient plasma on a slide and checked for agglutination. Importance of blood grouping or blood typing. Blood grouping or typing is important. Number one, blood transfusion for treatment purpose, for the determination of Rh incompatibility between mother and child, determination of paternity, which is done by the MN blood group system, choice of a donor in tissue or organ transplantation for genetic studies and for medical legal use, susceptibility to disease, like the people of blood type O are more susceptible to peptic ulcer, and blood type A is more commonly seen in gastric carcinoma. Now, you have to know why donors' red cells and recipients' plasma are considered in case of blood transfusion. The number one reason, the plasma in the transfusion is usually so diluted in the recipient that it rarely causes agglutination. Earlier, we have learned about the agglutination. What was the agglutination? Agglutination was the clumping of red blood cells due to antigen-antibody reaction. But the plasma in the transfusion, which contains the antibodies, will be diluted in the recipient's huge amount of blood. And as it is diluted, it will not cause any agglutination of remarkable amount. And the number two is, however, when the recipient's plasma has agglutinins against the donor's red cell, the cell agglutinate and hemolyze. Which blood group system's individual is considered as the universal donor? Type O individuals are called universal donor because they lack A and B antigen. Remember, type O blood group. Type O means there is absence of antigen A and antigen B. O stands for 0. And type O blood can given to anyone without producing a transfusion reaction due to ABO incompatibility. And who are the universal recipients? Persons with type AB blood groups are called universal recipients because they have no circulating agglutinogen or antibodies in their plasma. According to the Landsteiner's law, if there is presence of agglutinogen or antigen on the red blood cell membrane, there will be no corresponding agglutinin in their plasma. As we have now, both A antigen and B antigen is present in the AB positive blood group individual will have no alpha or beta antibodies. So it can be given blood type of any type without developing a transfusion reaction due to ABO incompatibility. However, this information you have to keep in your mind. Blood should not be transfused without being cross-matched except in the most extreme emergencies because there is possibilities of reaction due to incompatibilities in system other than the ABO system. As we have mentioned earlier, there are some minor blood group system which can create a havoc in case of blood transfusion. What are the hazards of blood transfusion? The number one hazards, there is a possibility of transmission of disease. The disease which are blood-borne like AIDS, hepatitis B and C, syphilis, malaria, etc. can be transmission through blood. Number two, incompatibility due to mismatched transfusion. Be divided into two parts. There are some immediate reactions and some delayed reactions. Immediate reactions includes for the ABO incompatibility, there will be fever, severe pain in the back, chest, limbs. There will be suffocation, chest tightness, chills, shock, and acute renal shutdown. And delayed reaction includes recurrent anemia, jaundice, and fever. Number three hazard, third hazard of blood transfusion can be faulty technique of transfusion. And these may cause cardiac arrhythmia, cardiac arrest, circulatory overload if repeated transfusions are given, chance of thrombophlebitis or air embolism. The fourth hazard of blood transfusion can be listed as allergic reactions like skin rashes and asthma may occur if the patient is sensitive to certain substances present in donor's blood. Number five is pyrogen reaction. Chills and fevers are probably due to the presence of antibodies to leukocytes and platelets. Number six is tyranny due to plasma calcium fall because of delayed conversion of citrate to bicarbonate in the tissue level with massive transfusion. Number seven is iron overload. Repeated transfusion in the absence of blood loss may lead to hemochromatosis. And now acute kidney shutdown. We will learn elaborately in our next class about the acute kidney shutdown. This is all for today. Thank you all for having patience.